I want to say it like it is. Don't take Tylenol. Don't take Tylenol. There's no downside. Don't take it. You'll be uncomfortable. It won't be as easy, maybe, but don't take it. If you're pregnant, don't take Tylenol. And don't give it to the—
Okay, you have no doubt seen the headlines this week about the president and his administration making the case that using Tylenol during pregnancy is linked to increased autism risk. It's an announcement that has inflamed some in the medical community who argue there is no proven connection between Tylenol use and intellectual disabilities.
This is fear-mongering about autism. Tylenol is one of the only and one of the safest options for pain control in pregnancy, and that is an essential aspect of necessary healthcare. Pain and fever in pregnancy needs to be treated with Tylenol, and not treating pain and fever can lead to complications for the mother and for the baby.
Study after study has actually shown that there's no causal link with Tylenol and pregnancy and autism.
The makers of Tylenol issued a statement saying more than a decade of research has not found credible evidence linking Tylenol to autism. President Trump and his administration mentioned several studies to back their claim, the largest of which was posted in the Journal of the American Medical Association last year. Here's a closer look at what researchers found.
The study was done in Sweden and looked at children born in 1995 through 2019 for a total of nearly 2.5 million children. In the study, they controlled for many factors, including the mother's pre-existing conditions, including migraines, rheumatoid arthritis, chronic pain, and infection, 1 year before pregnancy through delivery. This was also a prospective study, meaning they asked moms at their first appointment and every appointment until delivery if they'd taken any Tylenol. This avoids possible recall bias, meaning asking those with a diagnosis if they remember if they took medication while they were pregnant. What they found initially is a 0.09% higher risk of autism until they controlled for siblings. This means they looked at families who had one child with a neurodivergent disability but didn't take Tylenol, and another when they did take Tylenol. In those families, there is likely a genetic component. When sibling control was accounted for, there was no link or association between Tylenol or acetaminophen use in pregnancy and an increased risk of autism.
Meanwhile, here at home, the new president of OHSU says the university will soon be starting research investigating causes of autism.
Our research center was just the recipient of a large grant from the NIH to investigate the causes of autism, but also what works best in helping families get their kids to better outcomes in autism. And this is part of a large package of grants that the Secretary of Health has offered academic health centers like OHSU across the country. So what I can tell you is that we have the scientists to help answer these questions, and I think we'll be able to help Oregonians across the state.
Now, he also told us that the university is working with the governor's office and West Coast partners to review evidence related to the president's claim. But for now, OHSU's clinical guidance regarding Tylenol use during pregnancy remains unchanged.
Recommendation still stands that a moderate dose of acetaminophen is safe. But again, these are questions that are always evolving with the science. And so this is a clear signal to us to look into that question more. And again, we're really excited about that new grant from the NIH that's really looking into what leads to the best outcomes for children with autism after that diagnosis.